Hyperactive bladder, also known as overactive bladder, is the uncontrolled or uninhibited contractions of the bladder that often are associated with things like frequency, urgency, and getting up at night. There can be things that people eat or drink that make it worse, and things like constipation can also make it worse. In cases where there's a neurologic source, then we call it neurogenic bladder. But unfortunately, most of the time, it's idiopathic, or we actually don't know exactly what causes it. The definition of normal has a lot to do with how it affects the patient individually. If they're at work and having to get up from their desk several times during the day and it's affecting their work or their life, then at that point that would be considered abnormal. Stress incontinence is the involuntary leakage or loss of urine with increases in intra-abdominal pressure. That could include exercise, coughing, laughing, and sneezing. And the reason that this occurs is because there's a loss of some of the pelvic floor support to the urethra and the bladder. This can occur during childbirth or prior pelvic surgeries. Any of those things can affect the support of the urethra and the bladder and cause stress urinary incontinence.